people call me an audiologist. Others call me a hearing nerd. Being human with hearing loss is like my superpower. As a hearing doctor, I get to help people hear their best while learning about the mysteries of hearing. Hello humans, welcome back to Dr. Rose Helps You Hear. I'm Stephanie Rose, and I have some great news. Clinic is going to be opening up on May 18th. So now I'm able to see patients in person again. We're going to have all of our PPE, but some things that need to change are definitely my treatment room, my office. So I have a lot of just stuff everywhere, and we need to make sure that there's all hard surfaces so that when we wipe them down, everything gets wiped. I don't want to sit there and be hand wiping each and every single little pen or tool or whatever it is I have on my desk. So as an audiologist, we have a lot of tools and we've got a lot of stuff that we need to use. So I'm going to be condensing those things down, getting them covered, putting them away. So I just wanted to give you a little look into how I'm prepping for that. Although it is a very interesting time in the world right now, I'm so excited to be able to help my patients hear better and to be able to do some things that we haven't been able to do for the last couple of months. So I'll give you guys a quick video once I'm done cleaning everything up to give you an idea of how those bare surfaces are going to be much easier to clean. It's going to be a little boring in here, but that's okay. Anything to stay safe and healthy. Okay, so one idea I just had is for hearing aid evaluations, I like to show patients the physical hearing aid that they're either interested in and I agree would, be good for them. Or just to show them what all of their options are, because some hearing losses are more flexible than others. So one thing I'm going to do is take all of my little, what we call dummy hearing aids, meaning they're the shape and the size and they don't work. So they're just for demonstration. I'm going to place them in these plastic bags. That way I can just quickly peroxide or disinfect the bag in between patients so that I can show the next one. And we won't be taking them out of there. It will simply be for a visual. So these are the really small IIC and CIC, so invisible in canal and completely in canal hearing aids. And then I have just the full shell, half shell, in canal type style hearing aids. So that's going to be one of the protocols I'll implement. Okay, so I also have my behind the ear hearing aid. So we have a RIC style receiver in canal with a mold, and then a behind the ear style with a acrylic ear mold. This other one was silicone, that little canal one. So that'll be easy to show patients and then wipe down. The other things that we use a lot during hearing aid evaluations are ear measuring tools, and usually there's just one and you reuse it from patient to patient. You can give these a nice wipe with an audio wipe, and usually it won't break down the little cardboard that it's made out of. However, audio wipes are not shown to be effective against coronavirus. So I have placed them into little plastic packets, and we can go ahead and wipe down those with the appropriate disinfectant. And I have them for pretty much every maker that I would use in a hearing aid eval. The other thing I'm going to be doing is placing color chips. So we have these little, they're like paint swatches for hearing aids to show what color they are. So I'll be placing those into baggies as well. One of them for my bone anchored hearing aid maker called Cochlear Americas is made of paper. So I'm going to actually tape across here because I was finding that it's really difficult for me to fan these out when they're in the baggie. So I'm going to just place a piece of tape there. That way I can see the name of the color and then what color it is while it's in the baggie. And then I can wipe the baggie and not get the paper wet. So there is that. Perfect. Okay, so the Phonak color chips are a little bit bigger, but they're also paper. So I went ahead and fanned those out so I can see the names and the colors. And then I found this lovely, really big bag. So that's how that one will work. Okay, so I came up with a hearing aid eval bin where I have separated everything and put them in little plastic bags for the little tools that I need to show the patients what kind of hearing aids would be great for them. So just a little look in here. I also put things into individual boxes inside of the bin and then used some hearing aid glue to mount them down so that they don't shift. So I have one for dummy hearing aids to show what they look like. Each one is individually wrapped. And then we have color chips for all the different makers so that I can just pull that out, kind of figure out what color they want, wipe it down, and then put it back once it's dry. We also have the more paper colored chips that are a little bit more difficult to spray down, also in a bigger bag. I've got my little titanium fit guide ready to go, and then all the different receiver wire measuring tools for each maker ready to go. So this bin is actually a little bit bigger than what I needed, but now I have some extra room in case I need to put some ear mold impression supplies individually bagged and just kind of keep everything separate in a little compartment so that it's easy to keep clean. So I hope you liked my ideas. Okay, so it's finally the end of the day. My hair's a mess, but it was so worth it because everything is nice and clean. So as you can see, I have all solid, flat surfaces now. It's gonna be much easier to clean when clinic gets to open next week. So thanks for watching. Please subscribe and stay well out there.